The best thing about working at the hospital is the variety. You know, you don't get the same thing every day. Every day is different, and a lot of the doctors and even the nurses have said to me, you know, you just don't know what's going to happen on a given day, what's going to come through the door. So the environment can be quite challenging, but it can be really rewarding because, you know, they do some amazing things here sometimes. In the Southern District, Narrogin is the hub hospital, so a lot of the smaller sites and the smaller communities outside of Narrogin feed into the Narrogin Health Service.
For our region, and I think there's about 20,000 people that feed into Narrogin, we are the definitive care, if you like. Our emergency department is becoming busier, and we also have the 24-hour imaging, X-rays, CT and bloods that can be done. So we have a lot more capacity with a doctor on the site.
We've got a fully staffed emergency department with experienced nurses and CT scanner and all the bells and whistles. We'll set up medical ward, general ward, and an obstetric unit. A very committed and efficient allied health team who provide an excellent support service that's a big help in getting people back on their feet, literally sometimes, and back into the community.
So theatres here were upgraded about 4 or 5 years ago, so it's a brand new theatre complex. Everything's new, lots of new equipment, all really purpose-built for us. So we're very fortunate to have that available to us in Narrogin. That's great for us working in this environment and great for patients as well.
We provide, I think, a very good acute medical service to Narrogin, but also to the Southern Wheatbelt.
We are dealing with babies, the antenatal care, the whole spectrum from children growing through to teenagers and young adults, older people, to palliative care. Earlier this year, one of our medical students came here and delivered a baby, and then an hour or so later was down in the palliative care room when someone deceased. And that's the whole spectrum from cradle to grave.
Here we've set up reduced fractures, put in splints. We have done so many hands-on procedures that if you're practicing in the city, you won't have an opportunity to do that. So if you are such a doctor that is happy with your skills, what you have, you are happy to develop yourself further, Narrogin is the place to be.
It was a big learning, quite a steep learning curve coming from general practice to full-time hospital work, but I found it very challenging and I enjoyed the teamwork and I've got a junior resident who helps me. It's amazing how much they bring, having worked in those teaching hospitals in Perth and bringing the new ideas up.
In this day and age, our best clinical tool is the telephone. We must phone, and we're phoning all the time, and we get a lot of support from our tertiary hospitals. Yes, we have a small group that we can call on to help ourselves get through. We've got junior doctors now that we are sort of leading and that can help, but they need supervision.
The medicine's a bit different too, obviously things are more acute. We've got some quite sick patients in this that come through this hospital, and there was quite a bit of brushing up on internal medicine and hospital work. I guess in my younger days I had worked in rural areas when we didn't have the sort of support facilities we've got now, what with internet and video conferencing and whatnot. So yes, there is quite a lot of support.
I really enjoy breadth of practice, so covering a wide range of areas myself is very, very enjoyable, and having that range of skills and being able to have a lot of autonomy in our practice. I also really enjoy working in a small team, so instead of working with huge numbers of different people about you, almost never working with the same person twice.
Community life here, well, very good. Very, very good. We are a small community. It happens that everybody will know you as a doctor. Everybody knows you, everybody knows your family. We have a little recreational center here, I and my 2 other sons. We go and play soccer with the community. And those people I'm playing with, the children of my patients, some of them are my patients. It's one I played with last week, so the mom fell sick and came to ED to see me. So, you Dr. Nemi? Say, yes, so you played soccer with my son.
It was just a really good environment to bring the children up in, you know, they could walk to school, they had lots of friends. It was just a really good, inclusive community, and I think that's what I enjoy about it. There's 2 primary schools, 2 government primary schools. There's 1 Catholic private school, and then there's a regional high school, which has boarding facilities. So it goes from to year 12. Yeah, and the facilities up there are really good.
Narrogin's a town has got quite a lot going for it. The Shire is certainly doing all they can to reinvent it and keep it relevant. They're spending money on infrastructure, tidying up the streets, trying to preserve history. There's quite a sense of identity and that country life. There's a genuineness, and because this is a farming community, I've got to know some of the farming families, and they're genuine people. Some of them have been here for generations, and they're real gems. And even in the hospital, I think you'll find that there's quite a warmth of relationship. We have new people come in and they're embraced as being part of the family almost. So the small country towns have that closeness, that responsibility, looking out for your mates that you don't get in metro.